This video is for parents and legal guardians who may be or have been approached about permitting their children to participate in health research, and helps to explain why research involving children is necessary and important. In this video, we'll just use the term parents. Parents care for their children. They take them for checkups, call the doctor when they are sick, and give them medicine prescribed by doctors to help them get better. Parents rely on medical professionals to know what is best for their children's health. But how do the medical professionals know what is best? Research can provide this information. Research with children helps doctors determine whether medicines work and are safe for children and at what doses. Research with children is especially important because the medical community still has much to learn about the physical, emotional, and other healthcare needs of children of all ages. For example, medicines are usually tested in adults first. However, medicines that work well for adults do not always work the same way for children. Children are different from adults in many ways. Not only are children smaller, but their bodies may respond to medicines differently. In addition to testing medicines, researchers study many things about children that could help improve their lives. For example, research helps doctors understand how newborns grow and develop. This research may help premature babies live longer. Research also helps us understand how children deal with emotions, or what medical devices could help children with disabilities. Additionally, research in schools may help teachers design better lessons and counselors find better ways to prevent bullying. In all of these examples, research with children is necessary because it studies issues that specifically affect them. A research study usually starts with a question such as, which of these two medicines is the better treatment for this illness in children? Or, will this therapy that helps adults also help children? Researchers then develop a plan to test the medicines or the therapy and collect information to answer their question. Experts review the plan to make sure it has a good chance of producing reliable information that could help children. They also ensure that researchers keep the risks to children as low as they can. Children of all ages, including healthy children, may be asked to participate in research. There are many ways that children can participate. For example, in a study comparing a new medicine for an illness that affects children to an existing medicine, children with that illness might be asked to take one of the two medicines. The new medicine may or may not work better than the existing one, and the children who take the new medicine in the study may or may not benefit. The research will help the scientists find out if the new medicine is better. Sometimes, children may be asked to participate in research that doesn't provide any benefit to them, but what the researchers learn might be important for children in general. For example, in a behavioral study, children might be asked to solve a computer puzzle so scientists can learn about the mental abilities of children. This knowledge could be used to create better teaching resources for children or better treatment for children with developmental disabilities. In most circumstances, researchers seek permission from parents for a child to participate in a research study. Researchers are responsible for providing parents with the information they need to make an informed decision. This includes information about why the research is being done, what the researchers hope to learn, what the child and parents will be asked to do, and how the research might affect the child. Researchers should also tell parents if there are alternatives for their child aside from participating in the research. For example, what treatments might be available to the child outside of the research. As parents, You should think about the value of the research, what you would need to do for your child to participate, and how being in the research may or may not serve your child's interest. It is okay to ask the researchers questions about the study and your child's participation. You could also speak to someone else about your child's participation, including loved ones or your family doctor. In most cases, parents need to give their permission for a child to participate in research. Researchers usually also ask children if they are willing to participate. There are times, however, that researchers don't ask the children, for example, with very young children, like infants. But when researchers are working with older children, such as school-aged or older, the researchers should ask them to agree before including them in the research. As children grow older, they can better understand research and are better able to make decisions for themselves. Parents still need to give permission for teenagers that are minors to participate in research. However, it is reasonable for researchers to pay more attention to teens' ability to understand and think about the research. Researchers generally treat teenagers as young adults and provide them with more detailed information, similar to what they would give to an adult, to help them decide whether to participate. Parents can support their teenagers by talking with them about this decision. OHRP's About Research Participation website can help you learn more about participating in research. For more information about making decisions about participating in research, watch the video Informed Consent for Research: What to Expect. While you're there, check out the list of questions to ask researchers when you meet with them. Find these and other resources at www.hhs.gov/about-research-participation.